So this little pad right here, this is gonna sit right here. One of the common mistakes I see from other techs is they'll put this too high. So I wanna put that pretty far back, so now it's on the side of her knee. So make sure you're always putting the pad really far back here, because when she straightens her leg out, that's gonna be the side of her knee, whereas most people think that's the side of their knee. And then I like to tighten up the bottom parts. One thing about these straps, one side has a piece of double-sided Velcro. You can cut like a hairline off the outside of it, just to make it not poke them. And the other side has a piece of Velcro on it too. So you can adjust from both ends. Like this one's got a little bit of a tag in right here. So what I'm gonna do, actually, undo that one again, tighten it up from this side, and then that makes it a little bit shorter, or I can go a little bit more. So it comes back here. There we go, you see? So, and also, again, if that's just too long, you can kind of snip these just a little bit, move the Velcro back just a hair, and that way it's a little shorter strap. This is what's gonna go around the other side and clip in. So you've got one side that's got double-sided Velcro, and then this side's just regular Velcro right here. So you can adjust from both sides, right? So let's do that about right there. Come around here, clip this in. So there we go. So now it's gonna overlap a little bit. So there you go. There's that one. Trust, I know what's going through you guys' head right now. This is super complicated. That's why we do it and the patient doesn't do it, because if the patient does this, there's no telling what's going to happen. So what I'm going to do today, I'm going to get you fitted for this. So you're going to see a lot of awkward, random Velcro action going on. You won't have to do any of that at home. So really, I'm going to fit it to you, so all you have to do at home is click this on and click it on and off, basically. The only changes I tell them to make to the Velcro is just getting it a little bit tighter if they need to. Keep it really mild with them messing with the Velcro, because then the next thing you know, they come in, they got straps hanging everywhere. So you see that rest right on the outside. These are Flexion extension stops. That just kind of locks the brace in place. This is a screwdriver. If they have glasses, I'll give it to them. If not, I'll keep it, because you got to be wary. They'll come in here with a screwdriver and start messing with everything. Allen wrench we keep in our office as well, because if you send it home, next thing you know, you come in and the brace looks like this, and they're wondering why their knees hurt, and their brace is at like a 90-degree angle. Basically, it's a counterclockwise turn. So just go right in here, counterclockwise. And all it's going to do is put a little bit of pressure on the knee. So here's their inside of the knee. Here's the outside of the knee. It's going to look like that on the x-rays. So we're going to put pressure on the outside of the knee to roll it like that over time. It's going to be very light. This is tricky for some patients to understand, because they want to feel something when they put this brace on. They want to feel the change immediately. So a lot of times when I put like a quarter, like maybe even an eighth of a turn to put pressure on the outside of the knee, that's all you need, like an eighth to a quarter of a turn. But the patient's like, I don't feel anything. Well, you may not feel anything now, but if you go on a 20-minute walk with your knee brace, you might start feeling it after that. Whereas like if you really feel it after putting like a half a turn in there, and it's like really pushing on the knee, you'll do 5 minutes of walking and you're like, yeah, time for these things to come off. Typically, I like to put it up against the skin. It helps. You know, it might move around a little bit more if you put it on clothes. We actually have a knee brace wrap that comes with the braces. It's just a little thing. You sit on the Velcro, boom, and then you can kind of pull it around, get it nice and tight, and it puts a little extra pressure on the outside. They may need that if they fiddle around with it, mess with it, and it just won't stay put. Typically, when they stand up, all that tissue is going to kind of fall in place, as it were. So you may need to come in after they stand up and put just a little bit of extra pressure on there, get it in there. That one feels a little loose too, like that. And then try and get the Velcro on top of the other so that you don't have it rubbing up against their skin. So take a few steps in that for me. See how that feels. You feel like a very slight pressure on that? Yeah. Like you want it very slight, because you know after 20 minutes it may not feel very slight. So that's about all you want. I reiterate, like all you want to do is just click these off. Let us know if you have any questions. Right there, I'll click it in like that.